I'm thrilled to have you all here for today's Lunch and Learn event for the Community Engaged Scholarship Collaborative. These sessions are meant to bring together members of the community and campus as scholars and partners to learn from one another and to share expertise and lessons of partnership and impact. The goal of the collaborative is to deepen our individual and collective understandings and approaches for academic and community collaborations. And the collaborative also represents partners with expertise and resources in community engaged scholarship. Those partners include Duke Service Learning, the Social Science Research Institute, Duke Faculty Right, the Forum for Scholars and Publics, Duke Global Health Institute, Clinical Translational Sciences Institute, and Duke Civic Engagement. On behalf of all the partners who support the collaborative, we are so glad you joined us today. And my colleague Liz Shapiro-Garza, who in addition to serving as an associate professor of the practice of environmental policy and management, is also the faculty director for Engaged Scholarship with Duke Civic Engagement. Liz will help facilitate questions following the presentation today. I am delighted to have Dr. Norbert Wilson and Gideon Adams with us today to share more about their collaborations addressing food insecurity as shared partners and learners. They have a lot to offer us in our time together today. Norbert Wilson is a professor of food, economics, and community with Duke's Divinity School. Dr. Wilson's research touches on several food issues such as equity in food access, choice, and food waste. He continues to work on food safety and quality issues in international trade and domestic food systems. Dr. Wilson is also an ordained vocational deacon in the Episcopal Church USA. Gideon Adams is the Vice President of Community Health and Engagement with the Food Bank of Central and Eastern North Carolina. Mr. Adams has been involved in food banking for more than 13 years, where he started in traditional operations and programs. More recently, his roles have changed to encompass more holistic approaches to client and community service, working on strategies that impact the wellness of those served and methods to end reliance on philanthropic models. Thank you both for being here today. I'll now hand it over to you to share more of your stories of partnership and lessons learned along the way.
All right. Hi, everyone. I'm Norbert Wilson. I hope I'm sharing the right screen. Let me stop that. It's amazing. How long have we been on Zoom? And you'd think I would know exactly what I'm doing. So there we go. All right. Is that okay? Is that great? Thank you. Thank you for the opportunity to share with you all. And I'm excited to talk about the work I am doing with Gideon Adams. I'll tell you, I've been at Duke now for a little more than a year. And when I came in for the interview, I actually asked to meet with the food bank as part of my interview. I had worked with food banks before. I was on the board of a food bank in Alabama when I lived there. And so I was excited to make connections with the food bank in Raleigh. And it was a wonderful interaction. And they were open and welcoming. And I met Gideon at that point. And at the time, I was actually working on a grant proposal and at my other institution. And when I got to meet Gideon, I said, hey, I'm working on this, would love to engage you in this project. And that's part of how we kept going. And I'm also on a subcommittee. So I'm really grateful to Gideon for welcoming me into North Carolina. I want to do what we're going to do today is I'm going to talk a little bit about the issue of food security. I'm going to talk about some of the research I'm doing broadly speaking. And then Gideon's going to talk about North Carolina and the work that they're doing here. And then I'm going to talk about this one project that we're engaged. And I hope it opens up an opportunity for us to talk about ways that researchers and community partners can engage. And I see a couple of my colleagues from the World Food Policy Center on the call. And one of the things I know that they've been engaged before I got here, a lot of work engaging community partners. And I would be intrigued to hear what some of their experiences and thoughts on this too. So this idea of understanding food security, I think it's critical to actually just have a few moments of discussion about what is food security, or and which you'll hear me talk more about is food insecurity. And so some of the sort of traditional definitions of food security actually date back to earlier work on this idea of making sure that all people at all times have physical and economic access to sufficient, safe, and nutritious foods. and that those foods need to meet dietary needs and food preferences for an active and healthy life. And so this is the kind of overarching idea. In the academic literature, especially those who work specifically in this space, you will see that we really won't talk about the idea of hunger. Now, that's not to say community organizations or other folks not talk about hunger. We see that language used a lot, but this is the sort of structure that we frequently see in the academic literature. And the way we measure food security in the United States is the US Department of Agriculture every year goes out and through a large survey called the Current Population Survey, and it's part of a much larger survey, but there is a component that's actually conducted in December. And they ask people to reflect on the last 12 months. And these are some of the questions that are asked. It's actually either a 10 or 18 question survey. If there are no children in the household, there are 10 questions. If there are children in the household, it's 18 questions. And based on responses to these questions, they categorize households. And I want to make that point clear. It's not about an individual. It's about the household. So it's all the people who live in that house who are responsible to that head of household who's answering the questions. And so the questions center on a number of different factors about access to food. And as you can see, this first question is about worry. Do you worry whether or not the food will run out? Questions are then all also center on this idea of the ability to purchase foods. And I think this is a critical component because in some of the early literature talking about food security, there was a recognition that people are able to access foods through the charitable food sectors of food banking, or food pantries, soup kitchens, or congregate meals, and other means. And the idea of the food security module is to say, are people having difficulty accessing food because they can't afford it? And so I think we can have a longer conversation about what does it mean for a family to feed themselves? What is the role of support services or communities to provide food for one another? And does narrowly thinking about whether or not you are able to purchase the food is an important question for us to have. All of this is getting at this idea of autonomy. Can I, as an individual, support myself and my family or my community, my household? And so you can see some of the other questions that are there. The questions get progressively, if you will, more difficult in terms of the weightiness of the inability to provide food. As you can see, you get down to the end, it's asking were there adults in the household who did not eat for a whole day. So the more of these questions you answer affirmative or you affirmatively, the more likely you're going to be classified in one of a couple of different categories. And the categories tend to are you're food secure, marginally food secure, and then the categories of food insecurity are you are food insecure, and then the most extreme is food insecure with low food security. In previous generations of this survey module, there was a category of food insecure with hunger. And that, as I mentioned before, we don't, in the academic literature, we don't talk about hunger quite the same way, but we can see that USDA once did and no longer does that. I think it's really important to look at this graphic about what food insecurity looks like. And I want to draw your attention to food insecurity by racial and ethnic groups. The top two lines represent Black households, Black non-Hispanic households, and Hispanic households. And you can see that they have higher rates of food insecurity than their white counterparts or even other non-Hispanic households. And these rates, of course, increased during the economic crisis of 2007 to 2009, the Great Recession. But it took a long time for the households to get back to their pre-recessionary food insecurity rates. And of course, we've just been or still are in, I guess, a pandemic. And this is a slightly different measure, but this is about, and forgive me, I meant to correct the title. This is not about food security, this is food sufficiency. It's a slightly different measure. So because of the pandemic, there is a pulse survey that's been conducted by the government to sort of see what's happening on a month-to-month basis around issues of economic viability and well-being. And one of the set of questions is about food sufficiency. It's very similar to the food security measure, but it's not exactly the same. And what we can see is that the difference between Black and Hispanic households has been indicated in previous periods of that of the survey, but there was a great deal of concern of substantial increases in the insufficiency for children in households dealing with food sufficiency problems. But one of the things that's important to note is that when we see the data on what food security looked like from 2019 to 2020, so pre-pandemic and during the pandemic, and that's what these latter two data points represent, we see that food security actually held constant on a national basis. And for some in this space, this was rather surprising and actually a little bit disconcerting. But it does suggest that various policies that the government implemented may have actually helped tamp down the potential rise of food insecurity that we were concerned about during the pandemic. And food banks played a critical role in providing food to families that were struggling during the pandemic. So there might have been a number of different factors that came into play that actually helped prevent the food insecurity rate to rise. However, the problem isn't quite that simple. And so these are data that come from USDA. And what we see is that household food security, as I suggested, stayed constant from 2019 to 2020 at 10.5% of all US households experiencing food insecurity. But for white households, that number is 7.1%. So there was actually a slight drop in white households' food insecurity during the pandemic. But there was an increase in food insecurity relative to white households or Black households at 21.7%, and also for Hispanic households at 17.2%. And this is really troubling, trying to understand and tease out why we see these gaps in food insecurity by racial and ethnic groups. There was also evidence to suggest that Southern states had a sort of higher rate of food insecurity than other states. And so this is also an important point. And so I want to draw our attention to a few things in terms of some of the work that I've been doing. Sorry, I lost one of my points. I didn't mean to. Looking at food insecurity across region and racial groups, looking at across the region, and then also thinking about our collaboration with the food bank. I really got the order of that disappearing mixed up, so forgive me. I want to share a couple of papers that I've worked on that help put this in context. And the first is thinking about differences across regions about food insecurity. So this is a map of the US. This is slightly older data, but it's important. So this is before the pandemic, and we can see the darker squares or states, represent states that have higher rates of food insecurity than other states in the US. And this is done by the USDA. The circles represent states that actually have a grocery tax. So in many states, we have sales tax on all products, and in many states, they provide exemptions for food products. And one of the things that this is kind of leading to is that we see these differences in food insecurity. And one of the factors that might be relevant for different regions is this idea that there are taxes that are there. This is a map that comes from Feeding America. It's called Map the Meal Gap, and it talks about differences at the county level of food insecurity. And you can see in North Carolina, the region of the state that is experiencing higher rate of food insecurity than relative to other parts of the state. And again, this is 2018 data, is the region that our food bank is addressing. And so when we look at these comparisons, we can see that there's a general sort of relationship between these high rates of food insecurity and where we see the grocery taxes existing. And so I'll just give you the upshot of some of this work. And what my colleagues and I found is that the presence of this grocery tax actually seems to be related to higher rates of food insecurity, such that given the average grocery tax, we can see a pretty large increase, or 3% increase in the probability of a household being food insecure. So even state level policies can have an effect, or at least may correlate strongly with food insecurity. And we found, as many people have found, that the presence of SNAP, the Supplemental Nutrition Assistance Program, or the food stamp program, can actually have the ability to lower the likelihood of a household having food insecurity. So this was an important finding because the SNAP program actually doesn't pay for the grocery tax. It actually helps families not pay for that grocery tax because you can't use state SNAP dollars to pay for the grocery tax, so it's exempt. But SNAP doesn't cover the whole month. Frequently, families by the third week of the SNAP cycle are out of their SNAP benefits and are having to purchase foods, or they're going to or supplementing their foods by using food banking, the food bank. Another body of work that I've been engaging that's really informed the way I think about this and the importance of collaborations with the food bank is work looking at differences in racial and ethnic groups. And I showed you just the raw data that shows that there are differences in food insecurity by racial and ethnic groups. We also look at it by immigrant groups. And if you notice in that period of the Great Recession, there seemed to be this pretty sharp increase in food insecurity, especially for Black and Hispanic households. And we were interested in understanding if you took into consideration everything else, household size, education of the head of household, gender, number of children, do those differences disappear? And I'll go ahead and tell you, they don't. And what we were interested in was looking at not only the instance of food insecurity, as like whether or not a household is considered food insecure or not, but just the severity, how food insecure that household is. And we were interested in this recessionary period. I'll go ahead and say this may have some really important things to consider when we look at households during this time of the pandemic, because we know that the pandemic has had differential effects by racial and ethnic groups. We are really concerned that there may be greater disparities of food insecurity during this time. We're also interested in observing the contributions of these effects and then looking at SNAP. And I'll just go ahead and give you a couple of big overhead, big top ideas, and then we'll move on quickly to Gideon. When we look at the raw data, and then even when we take into consideration SNAP, we see that, again, Black versus white households are more food insecure. We see it also with Hispanic, and even with immigrant versus non-immigrant households. But the severity only shows that Black households have greater severity of food insecurity than their white counterparts. It disappears for Hispanic households, and not immigrant versus non-immigrant actually goes in reverse. All this is suggesting is that when we look at food insecurity, we see that there are differences by racial and ethnic groups and immigrant status. And we also see that where the severity might be different than what we see in terms of just the incidence. I've already made a point about this, but the last point I wanted to draw your attention to, and then I'm gonna turn it over to Gideon, is this idea that while SNAP is really an important public policy to help lower the likelihood of a household being food insecure, what it doesn't do, or what we don't find evidence in support of, is that it reduces the disparity. And so my colleagues and I have been working on some things to actually see what kinds of manipulations of the SNAP program could we actually do to actually reduce that disparity. But one of the things that's really critical for us when we think about what's going on in the food security world is that SNAP, while it's an important policy and it's critical and policy to actually reduce food insecurity, we also recognize that there are a number of other groups that are out there that provide support to individuals. And the food banks are a critical player in providing support to individuals who are in need of food support. So I would love for Gideon to come on. I'm going to drive the slides, but would like for him to share a little bit more about the Food Bank of Central and Eastern North Carolina. Gideon.
Thank you so much, Norbert. Yeah, so I'm going to speak a little bit on the Food Bank of Central and Eastern North Carolina, but also more sort of generally food banking as it's evolved over the last few years. I think to a great extent, the experiences and the evolution of this food bank of Central and Eastern North Carolina as a food bank is pretty indicative of the evolution that we've seen over these last 40 years. Thank you, Norbert, if you can move on. So as a foil to Dr. Wilson's sort of explanation on food security at the beginning here, we have a very sort of simplistic view within food banking as to what food insecurity is and the definition of it. And it really is simplistic and basic, and doesn't really go into the nuances that have been explained with regard to disparities and inequities. And we're really looking at the access to food and enough access to food for an active and healthy lifestyle, and it really does not speak, as I said, to those differing factors that we found during the research that has been mentioned. What we do see is really the vital signs, what we refer to as the vital signs of food insecurity or the vital signs of hunger, really pull out two of the questions that Dr. Wilson spoke to at the beginning there, of those 12 questions that are the full screening. And I think what you'll see as a theme as we move forward is how food banking has in the past rather simplified the problems that are faced by our community. And what we're going to hopefully show you today is how we can start becoming more particular, more focused, and more professional in our approach to this. Thank you, Norbert. So the food bank mission: nourishing people, building solutioning, empowering communities. Very, we hope that this mission is now starting to speak to perhaps more root causes of the problems that exist within our community. It has changed recently. That's our new mission. But our vision has stayed very much the same, and no one goes hungry in Central and Eastern North Carolina. Again, you know, I don't need to perhaps convince this audience of the importance of verbiage and words, but here we're looking at the word hungry, right? Hungry does not speak to ending hunger, and it certainly does not speak to the chronic situation that is food insecurity. So as we move forward, I'm sure this vision is going to be changing, where we do start needing to think about solutions to hunger rather than solutions to hungry, right? So that's really where our imperatives is starting to move. So again, you'll see that there is starting to be this more awareness on the part of food banking that we are changing, but we need to accelerate that change by bringing in these partnerships. Thank you, Norbert. Again, as you saw on the previous mapping and the instances of food insecurity, very prevalent in North Carolina is that central and eastern location. There's also a great prevalence out in the western states, out in the mountainous states, and geographically, I think, you know, they have geographical problems in terms of access to food. Whereas in the central and eastern area, I think we can see more economic barriers to food. The colored areas that you see there, the shaded areas in coloring, are those counties that are served directly by this food bank, 34 of the 100 counties in North Carolina. Each of the 100 counties are covered by a Feeding America food bank. Those gray areas that you see are not left hanging out. They are covered by other sister food banks that are part of the over 200 food banks that exist within Feeding America. And Feeding America is a national organization, the national organization that many food banks work under, that is really intent on the equalization of resources to those networks of food banks. Again, we start to see the failures in our direction when we talk about equalization of resources. There's no speaking of equity within that, and I think that's another direction that we're going to have to go to make sure that we are serving the populations that we serve far more fairly and far more justly than we currently perhaps do. Thank you, Norbert. So those community partners, Norbert spoke to some of those in the past. We have a network of over 900 community partners. Those predominantly are made up of religious organizations. They certainly don't have to be, but they are all non-profit organizations, all registered 501c3 organizations, who make up those community organizations that you might more readily recognize than the food bank, actually doing the coalface work of feeding people on a daily basis, right? Those emergency food pantries, those soup kitchens, congregate feeding sites, the shelters, and many programs for children and seniors as two sort of populations that have been identified, again, with very broad brushstrokes, as being more vulnerable populations. This network of, quite frankly, well-wishers in a broader sense, make up that Kelly's army in the fight against hunger, right? They are a mishmash of organizations that are volunteer-driven, community-driven, and I use that terminology to say, quite frankly, they are not professional, right? I think as we start to evolve, as we start to change our thinking on how we can solve this problem, we have to think of it in a far more clinical fashion and in a far more professional fashion. And we have seen food banks evolving to that extent. We have seen, I think externally, the language is sort of 10 to 15 years of late. The last 10 to 15 years, we've started to see a more professional approach to food banking. Realistically, I think it's probably more likely the last 5 to 10 years that we can say that hand on heart. But that direction of professionalism has really been concentrated on becoming professionals in the logistics of food movement. We have become very good at moving food around, but we have not become very good at assessing the impact of that food that's being moved around, and whether that impact is, quite frankly, the most effective that it could be, right? We need to get that efficacy of the food moved up, need to be accelerated in terms of its efficacy. Thank you, Norbert. So in an effort to start becoming more professional in this regard, we've started to see these changes. Food banks, certainly this food bank, have always been very proud of the fact that we have considered ourselves, and still to a certain extent consider ourselves, a community food bank. We are community supported. We feel as though we're part of the community. But again, unfortunately, that has had the implication that we're not professional, and certainly that inference has been taken up by more professional partners and more clinically minded partners that we're bringing on board now, who are quite frankly dragging food banks into a new iteration. So now we're not looking at the lottery of donations. Sorry, that's a typo on my part. We are starting to look more purposefully at culturally meaningful foods, addressing perhaps some of those gaps that Norbert has so eloquently shown us earlier on. The buying power of food banks, not now relying on donations necessarily, but starting to look at how we as organizations can bring our size to the table in terms of being able to buy more specific foods that have a greater impact on those that we serve, and more nutritional needs met for specific demographics, but also generally, that we've moved the moral imperative from providing food to providing nutritious food. And that we need now to keep moving in that direction, keep moving that imperative to now assessment and targeting of how we can impact and better impact those we serve with that nutritional food. Thank you, Norbert. Yeah. So the need within the service area of this food bank has fluctuated greatly over the last few years. We saw with the economic deflation of the sort of the late 10s, the 2008 onwards in the food bank, we saw a huge spike in the need within our service area. It started to level off and indeed started to reduce just in time for the pandemic to give society another kicking and increase that need again greatly. We have seen at a pantry level anywhere from 10 to 200% increase depending on where those pantries might be. Many of our partner agencies recording a huge increase in need. Some partners who I see on this call have indeed reported that. We are getting now perhaps seeing a leveling off. We're returning to perhaps pre-pandemic numbers, but these numbers are representative of that meal gap that Dr. Wilson spoke of earlier on. And that meal gap, the methodology for collecting that meal gap, those meal gap statistics is changing within Feeding America as well, so that we can actually start to perhaps be able to drill down a little bit further into the whys and wherefores, rather than, again, as I said, this sort of broad brushstroke that we've used in the past. Thank you, sir. If we can move on. Yeah. So the impact of where we are as our food bank, last fiscal year, and our fiscal year runs July through June, 138 million pounds of food, equivalent of 115 million meals. I will say that that fiscal year that I'm speaking about is pre-pandemic, where we've gone up to quite frankly frightening levels of food distribution and still not necessarily meeting the need. But the important figure here is really that, as you can see, that bottom bullet point, the vast majority of the growth in food distribution has happened in fresh, nutritious produce and what we refer to as foods to encourage. So I think around about 45% of the food that has been moved through the food bank has become fresh produce, and another 15 to 20% is representative of perishable foods, foods that we would see as having a positive impact on those that we serve with that food. So again, we've changed the way we're doing it. Yep, please carry on, sir. We've changed the way that we are providing food, and we have changed the way that we are talking about food out in the community with regards to educating ourselves and educating our clients on the use of that food, so that it does have that more beneficial effect. Here we talk just a little bit more about the COVID impact that we've seen, and our 79% increase of food over the same time frame from the previous year. We are already seeing a decline in those numbers because we are not getting the support necessarily of the increased foods that came through relief from the government. But again, that bottom bullet point, despite record-breaking distribution numbers, and quite frankly, we break records on a regular basis, almost annual basis, we're not yet meeting the meal gap that exists within North Carolina or nationally. So when we see these spikes from either economic crisis or, in this case, the pandemic, natural disasters, those are really just adding to an existing chronic state that we are not addressing fully yet. And many times you will talk to non-profit organizations, and particularly food banks, who profess to want to work themselves out of a job, right? To see those numbers come down so that we're no longer needed. We haven't yet gotten to the point where we have met the existing need, and we as organizations are still growing. And we, you know, we get this very sort of positive spin on, oh, food banks are getting bigger and we're getting bigger branches and producing, you know, better numbers with regards to distribution. That, quite frankly, is a failure on the part of our system, right? That is not something to be celebrated. We see that as a badge of dishonor, that we're not actually making a difference. So we've got to start getting to the point where we can see a reduction in the need, not just an increase in the amount of food that we're distributing. Okay, so that's a huge mental leap for us. We have met, I think last Tuesday, this food bank got to the heady heights of having reached its 1 billionth meal distributed within the 34 counties that we serve in North Carolina. And I say that again, not as a point of pride, but to perhaps illustrate the need that exists out there, and how chronic the situation is. And how do we do it? I mean, we do that by, quite frankly, our traditional methodology, right? Looking to address food insecurity. Now we're starting to look at how food insecurity affects the health of those that we serve, and how we can perhaps increase and better the health of those we serve. We act as this sort of clearinghouse for the wholesaler in the retail model, if you like. We have a massive community following with regards to volunteers sorting the food that comes through. And we then go out to this network of partners, a very simplistic plan and a very simplistic model. But that model is changing. And again, we're starting to get more focused and more professional. Yes, please, Norbert. If you can just move on this, thank you. And our methodologies are changing. So we're now moving from that distribution model, that philanthropic distribution model, to more targeted programming around nourishing the families that we serve, nourishing them in the most literal sense, right? A positive impact on the nutritional input to those individuals. We're looking at nourishing those at-risk populations that we, as lay people, have identified, and now starting to have deeper discussions with our academic partners on who else are those vulnerable populations? Who else are those populations that we haven't identified, that we don't see without research, without deep research and deep knowledge and deep understanding of the situation? So we see that nourishing, and this is where we start seeing those culturally relevant foods, those diet-specific relevant foods, those chronic illness state relevant foods that we can start to bring into play that are going to have a much deeper impact. Building up nutrition and building solutions and pathways to long-term food security. We know that giving food out is not the solution in itself. We know that a more holistic approach is needed. We know that public policy, EDI, benefits outreach and support are all going to play a part in how we empower our community economically and nutritionally to get out of the circle of poverty and to get out of the circle of food insecurity. And this is where we're starting to make these partnerships that can really start making those differences. And I'll pass it over back to Dr. Wilson to conclude for us.
Thank you so much for that overview. And I am really appreciative of the way the food bank has been looking at itself and thinking about how can it improve what it does and meet the needs of the community as the community also needs are changing. And I want to just mention in our last moment or two an example of how we're collaborating. And as I mentioned earlier, I was working on a grant proposal before I got here, and then it was awarded. And the food bank is actually one of our collaborators on this project. And it centers around something that happened really interestingly and gratefully last August. So the Biden administration made a change in how much money is given out through the food stamp program or through SNAP. And the way that money sort of increased was because there was a change in something called the Thrifty Food Plan. And so my colleagues and I at Tufts University, we were working on this project to understand the Thrifty Food Plan, which is the federally sort of constructed low-cost diet that meets nutritional guidelines. It follows the dietary guidelines for Americans, and it finds the least cost way of doing it. Based on that information, traditionally, we then say how much money families should receive for the food stamp program, or SNAP. And so what the administration did was it redid the Thrifty Food Plan to kind of figure out that the costs were not high enough and allow for a higher cost associated with, or a higher benefit to be given out through the SNAP program. And so one of the things that before this even happened, we were working on this project before that announcement was made. One of the things we were really interested in understanding is how is the Thrifty Food Plan working, or how would it be different if we assume something different about how low-income consumers consider their aspirations for food. And I think this is really important. And I realized that it could be perceived as a bit problematic in talking about different income levels and they may have different aspirations. It's important to understand that the Thrifty Food Plan was based on this idea of whatever current consumption is, that's what people want to continue to eat at higher levels of income or higher resource levels. And we know through the data that when people's income status change, their consumption levels change. The Thrifty Food Plan wasn't really taking that into consideration. And we were also concerned about how the nutrition constraints, and there are these food group constraints, were imposed on this model. And so we wanted to unearth this. And so think through what's really causing individuals to find themselves making choices that may not be the ones that would make with different resources available. And so the part of the project that we're working with the food bank on is understanding and trying to think through the aspirations and barriers that people are facing. I'm going to skip this slide, but just say that we're working with the food bank to identify individuals, to interview for the qualitative interviews, but we're also using the food bank as an important partner in sharing our research, understanding and contextualizing our research, but we're also going to share the research with the idea of working with the food banks to share our findings so that they can also think about their programming as a sort of collaborative, interactive way. While we're working with North Carolina, we're also working with a food bank out of Maine, the Greater Boston Food Bank, and also a food bank in Reno, Nevada. So we're working with multiple partners across the US to understand and to learn from them in our partnership. Thank you so much for this time, and thank you for this opportunity to share some of the collaborations that we're engaging in. And I'd love to hear more about your questions about the work that we're doing, but also maybe there are ways that we can think differently about our collaboration. So I look forward to your questions.
I just want to thank both Mr. Adams and Dr. Wilson, both for your discussion of food insecurity, but also especially here in North Carolina, but really also really thinking profoundly about partnership and what that means. So I appreciate that perspective enormously. We do have, we're going to be opening this up for questions. You can either put your questions in the chat or you can raise your hand and I will call on you. There's a little, if you hover over the bottom of your screen, there's under reactions section or tab, you can raise your hand, but feel free to put questions in the chat as well. We do have a question for Mr. Adams. I hear the word food and meal interchangeably. Are they the same?
Yeah, thank you. That's a great question, Fred. Thank you. They are not interchangeable, I will say, in terms of the verbiage of Feeding America and generally food banks. The term meal is defined as basically 1.2, near enough, pounds of food is the estimate on that Feeding America gives us to work with that would represent a meal. Now, food banks until fairly recently have really only just reported on the pounds of foods that they have moved. And more recently, the calculation has been done where we say the number of meals that we have moved. So, for example, as I said, we hit our 1 billionth meal distributed recently. That represents we've basically met our 1.2 billion pounds of food having distributed. The weakness that we have with that system, I mean, I'm sure it's pretty evident to most of you, is that when we, for example, do one of our famous mobile yam jams, right? The sweet potato distributions that have become so popular. Going to a partner agency with a truckload of 20,000 pounds of sweet potatoes, when that is reported statistically to Feeding America, they're seeing whatever the math is on that, 18,000 meals having been distributed. But there's no way on God's created earth that 20,000 pounds of sweet potatoes represents any number of meals, right? So again, it's an area where we know we need to start looking at this, looking at what is the mix of the distribution of food we're doing? Is it representative of actual meals that can be consumed rather than just pounds of food? And so, yes, we do distinguish it, Fred, but we need to do far more than just distinguish those two points.
Thank you. That's a lot of sweet potatoes. Yes. There's a question from Libby Towell. If you'd like to unmute yourself and ask your question.
Yeah, thank you. So this is a question both to just understand like the ecosystem a little bit better, and then also specific to kind of the research questions. So my question for Gideon is, when you think about the clients of the food bank, are you thinking more about those partners like the religious institutions or other nonprofits that you work with that then distribute the food? Are you thinking about the end consumer of the food? And I didn't necessarily understand this piece. Do end consumers, households, come to the food bank directly, or are they mostly getting those products through these other partners? And then how that relates to the research, Dr. Wilson, is when you think about, evaluating the product mix that the food bank provides or the services, or kind of interacting with some of those stakeholders to understand food preferences, are you then interacting more with these kind of intermediary organizational partners? Or are you interacting more with end consumers?
Well, let me start, and thank you for the question. Let me start, and then I'll hand over to Dr. Wilson. But when I refer to clients, I do refer to the end user, all right, those in the community that need the service. Although I do absolutely recognize that the food bank has a number of clients in the more sort of business sense, and one of those clients is our partner agencies. But more and more, we have recognized the fact that we have been one step removed or divorced from the client and the client experience, and more, not just because of the goals and guidelines of equity, diversity and inclusion, of getting the voice of the people we serve at the table, but just good old common sense. If we want to serve people best, we need to be talking to the people that we're serving. Right, so we have made that mental jump, and we are making that jump now to more direct services to our clients, more interaction with our clients, so that we can actually gather information. And I say information rather than data, because I think we need to move past that idea. Certainly at our level, we need to move past the idea of being data driven to being relationship driven, and that's where we really want to go with it. And I'll pass over to you, Dr. Wilson.
Sure. No, and thank you for that. And and forgive me if I may have missed a part of the question, and so correct me if I go astray on this. I would say the last comment from Ms. Adams is a really critical one, where I've been involved in food banking circles where I think it has not always been the case that food banks were really engaging clients, sort of end users, on what are their needs and what are the challenges. And you know, it could come from a variety of reasons, but I think there can be a challenge to really truly assess that, to assess the needs. A lot of the volunteers, I would say, when you get down to the food pantry level, are just somebody who happens to be working out of the church basement trying to meet some needs. And so I think in their approach, they may say, well, I'm providing food. Isn't that good enough? And I think the thing that we need to do is actually help them push beyond that and say, no, actually, we need to really develop the relationships so that we're not just providing food, but we're actually building those relationships and meeting needs that are really stated, not just assumed. And so forgive me if I've missed part of the question, but I think it is about building those relationships. And I'm learning more and more, especially as an academic, it's so easy to not develop relationships and to kind of stay in our silo and say, I'm generating knowledge. That's great. That is important. But it's about really getting on the ground and understanding the needs of not only just the needs of the community, but also being clear about what our needs are and what our realities are. So there is an interchange. If clients are saying they need certain kinds of foods, if those foods aren't available in the food banking network, we have to work towards changing the food banking network to actually meet those needs. So I think it takes a both and it's a communication that needs to go in both directions. So.
Miguel and Esco, I see your hands. I'm going to actually take a question from Minna Silverberg. She had her comment in first. It was fascinating to hear your thinking, how your thinking has evolved. Can you speak to any ways in which you see your partnership evolving as your work continues to evolve? And I'm going to just add at the end of that question, in what ways is your work on both sides enhanced by your partnership and relationship?
If I may, I'll start off and just say, I've learned so much about the needs of individuals who are struggling with food security by engaging food bank partners. In this particular example that I mentioned earlier, we work with our food bank partners to understand whether or not our interview guide is appropriate. But through them, we also start to learn about other groups. There's a group called Witnesses to Hunger. It's a group of folks who experience food insecurity, and they work with researchers to help us understand better their challenges. And so it was through those partnerships that we actually not only learned from them, but also learned about other people that can help us better do the work that we're doing. And I hope that the work that we're producing will be a part of the conversation. I'll just say one quick thing. I'm actually engaging in a conference called the Anti-Hunger Policy Conference, and it's because of my relationship with folks at Feeding America that I'm able to share the research that I've been doing with the larger audience of folks in this space. So I think it is a both and.
Yeah, and all I can really add to that is to say, food banking is a frantic environment. It's very sort of resource rich in terms of what we have to do. We quite often don't have the time to be able to step back, that sharpening of the blade kind of routine. And so I think we are going to, by necessity, build on these partnerships, build on those who perhaps can take a deeper dive, take a more clear look at what needs to happen, and collaborate on that. We are the dirty fingernails brigade, right? We're in there in the trenches, and so sometimes we can't really see the wood for the trees. And so I think these collaborations are going to allow us to figure out what we don't know. And I think those are going to continue. And I say that sounds very, very simplistic, but you've got to, from our point of view, we're really good at what we do, right? And we've started to, we believe our own hype, and we've drunk the Kool-Aid. We're excellent at this. It's a big step for us to actually start admitting that maybe what we're doing isn't all that we could be doing, right? So we need people to be able to give us that clarity, and I think these partnerships that's where that's gonna lie. People who can get our feet grounded.
I think we have time for maybe a couple more questions. Perhaps Miguel and Esco, you could ask your questions in sequence, and then Mr. Adams and Dr. Wilson could reply.
Okay, I'll try to be brief. There are 60 to 70 food pantries just in Durham. Most of us are partners of the food bank and some other organizations similar to the food bank. Well, the need for food in our community is increasing daily. It's not going down. The provision from the food bank and other organizations such as that is not enough to meet the present need. Now, I have not heard anything at all about how can we get engagement from the local authorities, from the local governments. They spend a lot of money in things like homelessness. They spend a lot of money like, mental health, many other things like that. Well, two things: if the people don't have food and shelter, obviously they are going to have mental health and many other issues. Why is it that we don't pay more attention to this?
Thank you, Miguel, for that. And I love your enthusiasm, but I will say, if we had a room full of advocates for homelessness, they'd be saying the same thing, right? So, I certainly don't want to give the impression that our problem is the biggest problem. It's just the problem that we're addressing. And so, yes, I would love to see more investment. I quite frankly would love for food banks to become what they were designed to be years ago, to become an emergency provision for people, right? We should not be part of the system. When people fall out of the, it's 2.3 weeks that SNAP covers, Dr. Wilson was saying beforehand, and then people start relying on food banks. That's ridiculous. We should not be part of the system. Your pantry should not be part of the system. You see the same people coming back week after week, I guarantee it. But what's going to be needed there is intervention and public policy work and information. The more information that we gather through research, through our academic partnerships, is going to give us more ammunition to build that public policy argument and get what we need. And quite frankly, the resources that it's going to require can only come from one place. And I'm afraid that's the government. You're not going to get philanthropic solutions to this.
I'm sorry, I'm afraid we don't have time for your question, but I really want to thank Mr. Adams and Dr. Wilson for joining us today, for sharing so much about and such thought-provoking information about both food banking, about food insecurity, and about the partnerships and between Duke University and the food bank, and the way in which that's moving the conversation forward. If you would, this has been sponsored by the Community Engaged Scholarship Collaborative at Duke. There's information in the chat about how to learn more, how to sign up for our newsletter, and about our next event. So please do join us. And again, many thanks. And I will just do a little clap, an actual clap, and maybe we can get some other reactions in the, through the Zoom reactions as well. Thank you so much for joining us.
Thanks.